So the big question first.
Yeah.
When does labor actually start? Like, when do you need to head to the hospital or birthing center?
Well, our source points to a couple of main signals. Either you're having consistent contractions, and it mentions the 511 rule as a sort of trigger.
Okay, the 511 rule. Can you remind us what that is?
Yeah, generally it means contractions are about 5 minutes apart, lasting for about 1 minute each, and this pattern has been going on for at least 1 hour. That consistency is key.
Gotcha. 5 minutes apart, 1 minute long for 1 hour.
Exactly. Or the other main signal is your water breaking the rupture of the amniotic sac.
Right. And the source emphasizes that 511 rule helps tell the difference between, like, early warm-ups and the real thing.
Precisely. It helps distinguish those Braxton-Hicks contractions, which can be irregular, from the steady intensifying pattern of true labor starting.
Okay, so you've recognized the signs, you head in. What happens when you first arrive? What's that initial evaluation like?
So the team there will focus on a couple of things. They'll monitor the baby's heart rate and your contraction pattern.
Yeah.
And crucially, they'll check your cervix.
Checking the cervix for.
For dilation, how much it's opened, and effacement, which is how much it's thinned out and softened.
Ah, okay. The source uses that turtleneck analogy, right? Dilation is the opening getting wider.
Exactly, and effacement is the turtleneck fabric getting thinner, preparing the way.
Makes sense. So that leads us into stage 1, dilation. The big goal here is getting the cervix to 10 centimeters open. And that can take a while.
Oh, it really can. Our source
Yeah.
notes this first stage might last, several hours, or sometimes even stretch over a day, or maybe even 2.
Wow, okay. A day or 2.
Yeah, and it also mentions that in early labor, when contractions aren't too intense yet, staying comfortable at home might be an option many prefer.
That makes total sense. But as things progress, the discomfort definitely increases.
It does. But the good news, as the source highlights, is that there are just so many comfort measures available, both non-medical and medical.
Let's talk non-medical first. Movement seems key.
Absolutely. Things like walking around, swaying your hips, or bouncing gently on a birthing ball. The source suggests this isn't just for comfort, but it can actually help the baby move down into the pelvis.
So it's practical too, not just about distraction.
Right. And changing positions is another big one.
Like what kind of positions?
Leaning forward over something, getting on your hands and knees. Even laboring in water, like a warm bath or shower, that warmth can be incredibly soothing.
Using gravity, maybe, instead
Yeah.
of just lying flat.
Exactly. The source implies that upright positions, or positions like hands and knees, can use gravity to your advantage, helping the baby descend, maybe even making the pushing stage a bit quicker later on.
Interesting. What about things like breathing techniques? Mind-body stuff.
Yeah, the source mentions those too. Deep breathing exercises, visualization, like picturing a calm place, or the baby moving down, or having a focal point, something specific to concentrate on during contractions. These can all help manage the sensations.
And having someone there for support sounds really important.
Hugely important. Hands-on support, like massage or that counter pressure on the lower back during contractions. Some people find that really helpful. A 10S unit is another option mentioned.
10S.
It's a little device that uses, dim lights, maybe some essential oils if you like them, calming music, and just having your partner or support person there offering encouragement, a cool cloth, holding your hand, that emotional support is massive.
It really sounds like finding what works for you is the main thing.
Totally. And it's crucial to remember, as the source points out, that medical pain relief is there too. Epidurals, IV medications, they're options if you need or want them.
So no judgment, no right way.
Absolutely not. The goal is feeling supported and empowered, whatever path you choose for managing the intensity. It's about finding your best way through it.
Okay, so you've worked through stage 1. The cervix is fully dilated, 10 centimeters. Now we're into stage 2, delivering the baby, the pushing stage. What should you expect here?
Well, once you hit full dilation, you'll probably feel a really strong kind of involuntary urge to push. It can feel quite powerful.
Like your body just knows what to do.
Often, yes. But the source does note that sometimes, maybe if you've had an epidural that dulls the sensation, you might need some guidance from your nurse or midwife on when and how to push effectively.
Right. And the goal here is working with the contractions, yeah.
Exactly. Using the power of those contractions to help move the baby down through the birth canal and out.
And how long does this pushing stage typically last? Is it like the movies where it's over in 2 pushes?
Usually not. It can vary a lot. Our source says anywhere from just a few minutes, maybe, to potentially a couple of hours.
A couple of hours of pushing.
It's possible. Factors like the baby's position, whether it's your first baby, and just how effective the pushing is can all play a role. But, the source gives this encouraging perspective.
Yeah.
Every single push is bringing you closer to meeting your baby.
That's a good way to frame it. And are there different positions for pushing, like in labor? Or is it mostly on your back?
Good question. While lying semi-reclined or on your back is common, it's definitely not the only way. The source mentions pushing while lying on your side, or squatting, or even on hands and knees.
And those might be more comfortable or effective for some.
They can be, yeah. It changes the angles of the pelvis, might use gravity differently. It's definitely worth discussing with your care team what feels best for you and what might help the baby's descent.
Okay. And the actual technique? How do they usually guide you to push?
Typically, the source describes it as taking a deep breath at the start of a contraction, then bearing down, kind of like you're having a bowel movement, holding that push for several seconds, maybe repeating it 3 or 4 times during one contraction.
Okay, bearing down like a bowel movement. And speaking of that, the source tackles a common worry head on, doesn't it?
It does, thankfully. It's something a lot of people worry about silently.
Passing stool while pushing.
Exactly. The source is very clear. It's actually quite common. And importantly, it reassures you that it's totally normal, considered a sign of good pushing even, and often the person giving birth doesn't even realize it happened.
And the staff just handles it discreetly.
Completely. The source mentions how professionally and quickly it's cleaned up. It's just part of the process for them. So really, it's not something you need to expend energy worrying about.
That is so reassuring to hear. Definitely removes a layer of potential stress. Okay, so you're pushing, the baby's moving down.
One push at a time, as the source puts it. It's usually much more gradual than TV portrays. Eventually, you reach the point called crowning.
Crowning. That's when you can see the top of the baby's head.
It's when the widest part of the baby's head is visible at the vaginal opening and doesn't slip back between contractions.
And this is often described as pretty intense, the ring of fire.
Yes, that's the term the source uses. It describes it as potentially the most painful part, a really intense, stretching, burning sensation. But crucially, it also emphasizes that this peak intensity usually only lasts for a few moments, maybe a contraction or two.
Okay, intense but brief.
Right. Your team will likely guide you through it, maybe asking for smaller pushes or just to breathe through it as the tissues stretch.
And then the big moment.
Yeah, with another push or maybe 2 after crowning, the head is born. Then usually the shoulders come out one at a time, followed quickly by the rest of the body.
Wow.
And just like that, as the source says, congratulations, you did it, you had a baby.
Incredible. Just incredible. But wait, we're not quite done yet, are we? There's still stage 3.
That's right. Stage 3 is the delivery of the placenta.
Okay, how does that compare to delivering the baby?
Oh, much, much easier usually. The source describes it as generally less intense. Your uterus will start contracting again, but usually much milder contractions this time.
And those contractions push the placenta out.
Exactly. The provider might put gentle traction on the cord or massage your abdomen to help it along, but the uterus does most of the work. They'll check carefully to make sure it's all come out.
Because the placenta's job is done now.
Precisely. Its vital role of nourishing the baby during pregnancy is complete.
How long does this third stage usually take?
Typically anywhere from a few minutes up to about half an hour, according to the source.
And after the placenta's out, what happens then?
Then your provider will check for any tears or lacerations that might have happened during delivery and repair them if needed. They'll use numbing medication, of course.
Yeah.
And this is also prime time for that immediate bonding, getting the baby right onto your chest for skin-to-skin contact, those first snuggles.
Lovely. Which really brings us into the start of recovery, even though labor's technically over. What's that initial period like, emotionally and physically?
The source paints a picture of, well, a real mix. There's often this immense joy, relief, maybe disbelief, but also, understandably, profound exhaustion.
You've just run a marathon, basically.
Pretty much, maybe an ultramarathon.
Yeah.
It's so important, this source stresses, to just acknowledge the incredible thing your body just accomplished. There's also a huge hormonal shift happening right after birth.
Right. That can affect mood, too.
Definitely. So while there's joy, that hormonal drop can also make you feel quite emotional or vulnerable. It's all part of the normal postpartum picture. Being gentle with yourself is key.
Absolutely. It sounds like a time for self-compassion.
Totally. And just soaking in those first moments with your new baby, letting yourself be in that moment.
So wrapping up this deep dive, if we had to distill the main message from our source about navigating labor, delivery, and recovery, what would it be?
I think the core takeaway is really about the power of understanding, knowing what the stages generally involve, what your options are for comfort and support. It can significantly dial down the anxiety and help you feel more empowered, more prepared for the experience.
Even though every single birth is unique.
Exactly. The path might look different for everyone, but having that general roadmap, knowing the landscape, is just invaluable.
It really is. And it makes you think, doesn't it, about the sheer resilience and adaptability of the human body through something so intense and transformative.
It really does. Maybe something to reflect on is just that thinking about these incredible physiological processes we talked about. How does understanding how the body works during birth maybe shift your perspective on strength or even on vulnerability? Something to ponder.